We talked about eating healthy before, but what about if you cut out all sugar between the first and the second test? Will that help? Because people told me to do that.
Between like the 1 hour test and then the 3 hour test? No, no. As a matter of fact, the 3 hour test there's a reason for why that's the diagnostic one. Like where if you fail that, you meet criteria, because we ask people to come in with a fresh slate. So you're not having eaten or had anything in your system for 8 hours. So you're fasting, and then you're a blank canvas, and now we give you that 100-gram drink to see how your body processes it with the numbers that you gather, because you get your blood drawn 4 times that day. It's a 3 hour long test, but it's 4 blood draws. I don't know if you remember. One before you drank it, and then each time for 1 hour after, second hour, and the third hour. So the body really doesn't care. You can't rewire your pancreas and insulin function and all that just by having a perfect diet between the two. We're really just looking at you in that narrow window of time when you have the drink and how you're going to process it. So it makes no difference.
Yeah. So, and I think it's important to just keep doing what you're doing normally anyway, because then the test will be accurate. It'll really give a clear picture, right?
Absolutely. Yeah, exactly. Especially for the first hour. Yeah. So some people will come in fasting for that 1 hour, the first one that kind of opens the opportunity of suspicion. Yeah, you'd rather, unless the diet you followed, let's suppose you did do that and you're following this diet that was recommended, and it's low carb and all the good things that we tell our diabetics to do, and you even decided to fast and you had this perfect number, yeah, you are essentially deceiving the test. And so that's fine if you plan on continuing that for the whole pregnancy and just treating yourself as if you are diabetic and following this perfect diet. So, but if you don't plan on doing that, then it's really not the best idea.
Even if you are following the perfect diet, you might still need insulin, because for me, I was really regimented. Dr. K, I remember calling her and talking about how my numbers at night were so high. And she said, well, did you eat something? I said, yeah, I had a red bell pepper. I don't know if that's really bad, because I'm thinking red is like sweet. She starts cracking up because she's like thinking it's cake or something, right? So, and I had leaned out. I mean, I was
so lean.
Yeah. I was so strict on this diet, and it still didn't work no matter what I did. One bite of a sweet potato would skyrocket my sugar. Yeah. So even if, some people are able to manage it with their diet, and I am quite honestly jealous, but some people can't. And that's just because of your hormones, right?
Exactly. And so that's phase 2. So now we get over the shock of being told you have it based on your numbers, and we tell people to start following diet, and you have to come to terms with knowing that it's not about what camp you fall in, whether it's diet controlled or medication. It does not matter. All we care about are those numbers. Are your sugars being consistently controlled? Because that's what's going to lead to good outcomes. We don't care whether you're on high volumes of insulin or nothing at all and you're just diet controlled. We just want those numbers in the end. And people have to come to terms with that, because I do think that it's intimidating to be told now you have to have insulin on top of poking myself 4 times a day, and it's all very daunting. I get it. I felt sorry for myself as well when I was going through it, but in the end, at least you feel like it's a proactive disease. You can be proactive and get good values and feel like you're in somewhat of control once you're on top of it.
So what if someone isn't taking this diagnosis seriously? What are some of those risks to both her and the baby?
So what are the risks? Gestational. This doesn't cover type 1 and type 2. Gestational diabetic risks are, if you're not controlled, you can have larger than normal babies. So it's called macrosomia. Larger than normal babies can lead to increased risk of a C-section if people have labor problems. You can have them actually not have trouble being birthed out. So once the head's delivered, then the other issue with diabetic babies are their broad shoulders. So there is this element of irregular distribution of fat in diabetic babies. So even for those who tend to appear to be a normal size, their fat distribution is such that there's more on their shoulders than the rest of their body, and it makes for really cute babies, but their shoulders can get stuck. So one of the things you had mentioned, the shoulder dystocia in our last talk, can happen more so for moms who are delivering diabetic moms who are delivering. So shoulder dystocia, labor complications, increased C-section, fluid, they can have more, women can produce more fluid in their uteruses. It's called polyhydramnios, more so if they have diabetes, and that can increase the risk of preterm labor. Having gestational diabetes also increases your risk of getting high blood pressure. This is the ugliest word and most unfortunate in my world, but fetal demise, babies dying for no reason. There's less of a risk for gestational diabetics, and significantly less. I mean, there's less of a risk if it's controlled, and significantly less if it's not controlled. But it is an element that unfortunately does exist in this diagnosis. But I've seen that unfortunate circumstance, but I have not seen it with my gestational diabetics. Let's put it that way. It can occur to any one of us, but with my gestational diabetics, because they tend to, our practice, I've just been lucky and I've had good patients who are committed to their health. I've not witnessed any one of my gestational diabetics have that issue, but I have to share that just so that I can really impress upon people the importance.
Yeah, absolutely important to take the diagnosis seriously and to take care of yourself and do the recommended, protocols, because it is something that is very manageable and preventable.
Absolutely.
So